All right, welcome back to day 2, everyone. Super excited to go in today after yesterday's amazing sessions and information and drumming and beating. I think if you weren't here yesterday, we hope to give you at least close to the same experience today. So a couple things just before we get started and before we get moved into our keynote address, a couple of housekeeping, and thanks to Shayna for all of the amazing notes that we have to go through. One of the big things today that we're going to hopefully ask you to be able to do, and we're going to keep giving you these gentle reminders and nudges, is that there will be a feedback survey. Super, super helpful for the YSPOR team to be able to have that feedback. I think they really took a lot of that into consideration and account last year moving forward. So you will wind up receiving these little scannable QR codes. They might actually be on some of your tables or they will be handed out. It's a really short, maybe 5-minute survey to go in and do. How did things go? How was the work? What are those aspects? So just going in to make sure you answer that. If you don't have a cell phone and you want to be able to do it, there is a fellow named Mark. Mark, right here. Mark will be able to help you. So if you are having trouble, you go and see him and he will help you out. For our hubs, we also have it set up for you. There are QR codes there. Same thing. If you're having any trouble, Jamie and Dawson will be able to give you a hand, or Lyris up in Old Crow will be able to give you folks a hand as well. And then for all of you who are joining us online, who are here right now, we'll continue this reminder throughout the day. There will be a link that's put into the chat for the folks online. So please pop in there, take the 5 minutes, do the survey for the folks. And of course, and as Tosh reminded us yesterday, door prizes for everything are massive. So if you fill out your survey before 2:30 today, you'll be entered into a draw for one of 2 Air North gift certificates. Nope, I lied, not Air North. I was getting all excited about the Air North guy yesterday and flying. 2 $200 Visa gift cards. So you could buy an Air North ticket or you could spend it on Christmas presents or whatever else you might like. But those will be the prizes. So one of 2 of those. And so make sure you do that. We'll keep giving you those reminders throughout the day before 2:30. We'll give you that little prod to say, hey, go in and do that survey. Another piece that we want to bring forward, I think Michelle had mentioned Kevin yesterday. And poor Kevin felt like he was maybe a little bit alienated by it and people avoided him. So we want to give Kevin the opportunity to come on up and introduce himself and just give a little bit of information about what it is that he's doing and how he's supporting YSPOR. He's not auditing YSPOR, but he's really trying to help them. So we want to give him the chance to explain that to you folks.
Hi, everyone. It's a pleasure to be here today. Really thankful to be a part of this. My name is Kevin. I'm a manager with MNP. I'm a born and raised Yukoner and actually located here in the Yukon. And as it's been said, I'm really just here to help out YSPOR. I'm here to evaluate and identify your strengths, the opportunities that are presented to YSPOR, and how we can leverage the strength to better the processes and the way that YSPOR functions. So I'm here today really just to kind of see how things are going, what are the priorities of the group, and that's really helping drive what the evaluation is going to be about. So if you have any thoughts, this is really your opportunity to kind of help us in understanding what we should be focusing on. Come find me, come chat with me. As part of this as well, we are going to be doing some engagement with folks. And so if you are someone that you feel like you have a lot that you want to share about YSPOR and you're very passionate and you have some great opportunities of how we can improve, please do come find me and let me know so that I can grab your contact information and we can further the conversations through this. Thank you.
Thanks, Kevin. So Kevin's a helper, not an issue. Definitely share your opinions and ideas with Kevin if you have the time. One of the other things we wanted to draw your attention to, I know we mentioned it yesterday, but we do have some displays and some other things that are happening in the various rooms around the center. So we have some artwork that's up, and we just wanted to give you a little bit of information and background on what that was. So let me just make sure I get the room right. I think that it is in the activity room. So just down the hallway, past the kitchen and off to the left. YSPOR had Alexa, who is a youth who worked with both Nina Bolton, who is an elder for Yukon University, as well as Anne Wrangler, who we got to hear from yesterday, who was one of the YSPOR elders, over this past summer on a knowledge sharing project. And so the results of her project were a painting and a poster. And so we have those up on display in the activity room. And her mentor, Robin, will be in there available to answer any questions about their work, any of those things. So on your break, when you're not doing the survey, if you want to make your way down and take a look at some of those things. And just to note that YSPOR did work with a number of youth this summer on multiple projects, including Aaliyah, who's here at the summit representing Communities Building Youth Futures. So they also have a booth that's set up here. So just in the elders room right out the door, definitely pop in, have some of those conversations, see what's happening in those two rooms over your breaks. A little bit of a plug for some upcoming events. So YSPOR is hosting an evening event on July 11th. And this event will provide a more in-depth conversation around engagement with people with lived experience and communities in health research. So right now, the details can be found on an event poster within your folder. So we see the folders on the table. We've got the posters there. Definitely come out. I think we heard lots yesterday about people wondering what that looked like. How are we inclusive of people with lived or living experience? And how are we doing that in a good way? And so we have this event coming up that's really meant to kind of bring that to the forefront. Am I going to say lastly? No, not quite yet lastly. So third to lastly, we had an awesome keynote yesterday. If you missed it, don't worry about that. All of the sessions have been recorded. And so if you would like to be able to do that, you can reach out and those things can be shared. As a part of that keynote, there was a book that a lot of people were asking about, Parents Like Us. And so a number of those were handed out. I saw some more of them sitting over on the table this morning. There are some extra books. And so if you would like one and did not receive one, Riley, who is wandering across the back there, arm up, she would be able to help you put your hands on some of those. I think an amazing resource from what we heard and understood. And then YSPOR does have a newsletter. And so if this is interesting to you, if this has been an exciting couple days and you aren't already subscribed to the newsletter, definitely reach out and do that again. The wonderful Riley is the person who can help you with that. So nabbing Riley for any conversations today is probably going to be a massive benefit to you and how you want to continue to contribute. I think yesterday we did hear a little bit about how heavy some of these topics can be, how they bring up some of the feelings and things that we have been dealing with. I think we had an amazing prayer that came in to help us work through some of that, but the team also thought, you know what else could we do? And so we do have Michael Berman. Can I get a hand from Michael? There we go, in the back. Nice bright green sweater so you can easily find him. From Health and Social. So he's joining us on site today as an on-site counselor. So if you need support, if you need someone to talk to, Michael's here to connect with, and you have that now at your fingertips. So that brings me to the end of our housekeeping, and we can jump into today's agenda. And so, as we said, amazing keynote yesterday, lots of fantastic things to think about. Yet again, today we are joined by another absolutely amazing keynote, and I won't spend too much time introducing her because I'm sure she'll have lots to say and share with us herself. But joining from Old Crow, we have Chief Pauline Frost of the Vantuk Gwich'in, who is a former minister of Health and Social here in the territory as well, who's going to spend some time with us this morning talking about some issues that are really relevant to this conversation. So a nice warm welcome for Pauline.
Van Queensy. Everyone, it's really great to be here with you all today. I had hoped to be there in person, but we have a great venue here in Okro as well, with some Vantakwichan citizens and great support staff. So just want to acknowledge the traditional territories that you're sitting on there in Whitehorse, Kwanlinda and on Wet'suwet'en Council, and the history and the rich history that they bring. Also just acknowledge the elders and the ways of the Gwich'in people here in Old Crow. I think it's important for us to take a moment just to say thank you. Thank you for giving us space, giving us all opportunities. And I want to just I know I have 1 hour, so 1 hour is to some people is a lot of time, but on a subject like this, I think 1 hour is sometimes not enough time. It's what can you put in that 1 hour? What do you hope to address and capture within a few key statements? So in getting into that, I want to just give you a little bit of background of myself. So it kind of sets the tone of where I come from. So I'm born and raised in Old Crow. So I was born on the banks of the Porcupine River, at a very small health center, many years, 1963, prior to proper healthcare services in the territory, in the community. And I want to say that at the time we had a midwife, and the midwife birthed me with support of some healthcare service staff here that were, and prior to that, it would have been the RCMP. So that's where I was born. And as a young person, we grow up in these environments, and we don't think a lot then about what future holds. We think about time and space. We think about where we are, and we think about what's here for us in our little community. And that in 1963, and as my evolution of life, I guess, as I evolved in my career and in my life, I realized that not a whole lot has changed for me. I'm still home. I still dedicate my life to my people. I still dedicate my life to the children. I still volunteer in the community. I still ski. I still work with the children. It's what I do. I learn to be a part of space and time and community. And in a good way, in a healthy way, but at the same time, as under our agreements, I'm defined as an elder. I don't see myself as an elder because I have a long ways to get to that place and of acknowledgement. I'm learning the tools of our Gwich'in ways, and the tools of maybe just working and walking in two worlds, and acknowledging that I do well on the outside of the community, but my passion and my heart's here in my community. And so I chose to come back to community to work with the government as a chief, but I still am passionate about health and health services, passionate about the children, and passionate about ensuring that we evolve in a way that is well-rounded, that it's rounded and rooted in culture and ways of knowing and being and doing. I would say, I don't speak my language, but I understand because I was raised by an elder. And in a way, I'd say that we define when we're happy and our heart's happy, and my heart makes me happy because I was taught some really valuable tools of the culture, and that is really about customary practices, emergence of contemporary practices. So what do we do traditionally when someone becomes ill? What do we do when someone is not well, either mentally, physically, or spiritually? Well, we gather as a nation, we gather the tools around us. That is no different now, but than it was back in the 60s and 70s and 80s in Old Crow. So I as a young child, I left the community. I left the community to attend high school because that was the way of the future, I guess, and that we took all young children out of community to attend high school. So I left when I was 13. I didn't come back really until I was 18, and stayed for 2 years, and then I left again. And I've been back and forth since, and sometimes I stay longer than others, and I want to just kind of use that as a segue, I guess, to my key messages today, because as a youth, I would say youth, but I was a young adult, working with the politicians of the day, Harry Allen, Robert Bruce Jr. We also had Paul Burkle, Dave Joe, Elijah Smith, all the trailblazers. And at that time, my mother, Alice Frost, along with Judy Gingell, were leading edge of change in Yukon. And leading the change in Yukon had to deal with our self-government agreement. It was about self-determination. It was about resiliency. It's about designing a roadmap. What does a roadmap mean when we settled our umbrella final agreement and then our self-government agreement? So new governments, 1993, and I was invited to participate in and share in ceremony, and I did, and I learned a lot from that time to now. So while diverse, I guess, very expansive and vast career, and a lot of it was in health, which is ironically enough, I never really planned it that way. It's just I went to thought I would become a social worker, so I studied social work, and then I somehow enjoyed creative writing, so I ended up doing creative writing courses, and then I realized, hey, look, I have all these Northern Justice Criminology certificates and programs and that I've taken through the Yukon University. Oh, look at this! Isn't this interesting? All of a sudden I started focusing more on the law side, negotiations, and so I want to just say that is interesting. But in 1999 and 2000, I was brought on with the federal government during devolution of health transfer agreements from Canada to Yukon government. And along with myself, there were others there, Lisa and others, that led the file for Yukon First Nations. So we tried to look at devolution and what devolution looked like, right? The agreement was funded by Canada. So our health authority management was then done by Canada. And we devolved that down to the government of Yukon, all aspects. There were some residual responsibilities that stayed with Canada. So if you think about it, what we see today is exactly what we devolved in 1999 and 2000. Have we changed a lot of our perspectives and roles and how we designed service agreements? I've thought about that since I was asked to do a keynote address, and I'm thinking back in time. What was it that we devolved to the government of Yukon? What was my role? What was the role of other Indigenous leaders at that time? And then what was the residual responsibilities? What stayed behind with Canada? And how did we set it up to be successful? I would say that devolution happened really by virtue of just transfer of program services and not a whole lot of thought put around it, around implementation, innovation in research, and innovation in data analysis and collection, and innovation in growth and development, and linking that very closely to our self-government agreements. I would say that from my observation now as a 60-year-old and from some 30 years ago, what was I thinking back then? What did I learn back then? And putting that into today's context. So the circle that we're talking about from 1999 to now is really about moving the First Nations forward, moving the Yukon government forward in a way that is mutually, a mutual arrangement, a mutual agreement, and delivering like services to Yukon government in our context of our self-government agreement, it's really important we talk about the context and what it means, because in our self-government agreement, it speaks about services to Yukon First Nations that are equal to that of other Canadians. It's really clearly written into our agreements, meaning that there should be no tiered system of approach anywhere. We should never see a system that marginalizes one population against another. But that's the case today, and that was the case in 1999. Was the objective of our self-government agreement to equalize services and provide assistance and implementation effectively. So I stayed not very long within the federal government. I moved quickly over as a negotiator on the negotiating side and started working with Yukon First Nations. So I've had the privilege of working with many First Nations. In fact, I worked with Trontek-Witchin. I spent 7 years in Dawson City implementing, designing policies, helping with the human resource drafting and strategies. And I went to work with Pauline as well. I went to work with Ta'an as they, started looking at some reviews when the first 5 years of their agreements, and focus mostly on my own community. And in that era, we were moving and trying to adapt and adjust and fit in. And I think that it's important to look at how and what the context of our agreements define for us. So many years later, I've learned a lot about our self-government agreements, about implementation, about negotiating down and drawdown of services to a First Nations community-based model. So I did that on behalf of my government, working with various leaderships over the course of 20 years, and it was really about trying to negotiate based on data, based on research, based on best practices and evidence. So it's always about evidence-based approach to logic, right? About policies and such, and so. But at the same time, if you look at my role most recently as a Minister of Health and Social Services for the government of Yukon, I was the minister responsible for housing with social supports, which made a whole lot of sense to me, but maybe didn't make a whole lot of sense to other people, because I see it as an individual lens, I guess, perhaps an individual's place and time is, what do you need? How can we help you? Because we don't see housing as a fundamental human right alone and by itself. We see the need to support the individual to be successful in that home, whether it's the individual by themselves, with their family, with their children, or with the community. So we think about these things, and as a health minister, we quickly realized, and I want to just kind of put this into a bit of a perspective. In my community, and quite a few years ago, we go through this thing called custom adoption, where I had the privilege of being raised by my grandmother. She would take me out on the land in the spring. Generally, we leave in March. We don't come back till June. And she didn't speak a whole lot of English, nor did she read fluent English. She was a Gwich'in speaker and a knowledge keeper. But at the same time, during that era or that time, we think about how did they do it? How do they do it now, right? How do the elders take care of their children and teach and pass the knowledge on from one generation to the next? That's what we've done historically, is knowledge keepers. And I see that the SPORE, which is the Yukon Strategy for Patient-Oriented Research, is intended to look at health research through training, capacity development, knowledge sharing, and translation. But the objective is really to look at lived experience, learn from others, and build resiliency together. And you think about resiliency of Yukoners, you think about resiliency of a marginalized population, and you think about what they've done. Why is it that they are so successful, right? And the tools that we have brought forward and integrated into the healthcare system. And which brings me to the point I want to make with respect to custom adoption. A little resolution was passed at our annual General Assembly in my community a few years ago by my now deceased auntie, Marion Dinucon, that said, why can't the governments help the grandparents that only bring in $1,800 a month through their old age security and help them raise their grandchildren so that we can get them educated and, and have food on the table? And because they do it for other children, there's foster children and families and parents that get supported. Why can't we get supported? So we put a little resolution forward and forced our own local government to advance. And while lo and behold, don't we now see an extended family care agreement in the government of Yukon, right? How did that come to be? It didn't come just from a little resolution in Oak Grove, but it came from, for the government to make those types of fundamental changes, you need to have followed the data trail. You need to have followed the research. How many children do we have in care? How is it that we went from 495 children in care to 16 children in care in 1 year? How is it that the Manitoba government is responsible for 11,000 children in care? And what is the solution? Right? Solution is based on research. Solution is based on working together. And we are a resilient people as Indigenous people. We nurture relationships together. We nurture our relationships with our community, with our partners. We start looking at what is it that we can do from a two-eyed seeing perspective, an Indigenous perspective. How do we look at customary practices of lawmaking, of medicine, and merging that with the contemporary ways of Western society, I guess, in that, and scholars, right, always wanting to analyze and research. And we just went through this exercise with COVID, right? And the outcome being what? What do we do with that information? As we ask ourselves those questions. So you think of research as and data in the same context. You can't think of one without the other, because as soon as you start researching, you're going to start coming up with some themes. You're going to start thinking about values. You're going to think about time-honored traditions. You're going to start thinking about honoring the Indigenous ways of knowing and doing and working and playing in our world. And one would ask the question from, I guess it would be in 1963 when I was just born, how is it that we had an Olympian reach the Olympic Stadium? How is it that in 1973 we had 3 Vantakwichan young women reach the Canadian national podium and representing the same family division as one ranked 1 to 4 in Canada as at the Canadian National Ski Championships? How could that be? What does that mean? So we had was it the lifestyle? Was it health? Was it healthy living? Was it were they more active? And so we asked ourselves these questions. Why were they so successful and resilient back then? And what changed from then to now? What changed from 1993 to now? We then start looking at analyzing the data and collecting the data. We know we are successful. We know we're successful people across the Yukon. We know we are adaptable to change, and climate is one of it. We adapt to climate, we adapt to changing environments around us. And the objective of research and data collection is really to look at, just imagine for a moment your own individual health data here in Yukon. Some of us, like me, who live and plays in the traditional territory of Vantakwichan, still travel around with a manila envelope with my records under my arm if I wanted to move things along. Is that appropriate? So when we start collecting data, we talk about fiber redundancy, right? Redundancy, because you can't, and One Health, because One Health is where a data repository, research is deposited somewhere. What does the data say to you? What does the research say to you? And so research comes with data is what I want to say. And one would argue that maybe one doesn't belong with the other, but they really truly do belong together. And in the case of a patient-centered approach to health, it is absolutely essential. One must collect data, observe trends, time and place and space in order to define potential outcomes and improved models of care. So I asked myself these questions as the health minister. I spent 4.5 years working as a health minister for the government of Yukon. At the same time, I was an environment minister and I was a housing minister. And I sat at many federal tables discussing federal policies, discussing regional policies, and the territorial health initiative funding that associates with devolution. And so I smile as I sat at the table because I thought, well, look, I was there as a young person at the forefront of devolution. And here I am sitting here analyzing devolution by looking at the territorial health initiative funding and its inadequacies. And my mind, I wanted to know what's happening with Indigenous services, what's happening with the three-tiered system that we have in place. We have Yukon First Nations people trying to govern themselves and support and putting little resources into healthcare, health of its people. The government of Yukon is responsible for health, critical and essential health services to Yukoners. Canada is then responsible for the non-insured health benefits. That's pharmaceuticals for First Nations. That deals with medical travel for First Nations. And the coordinated effort of all three is fundamentally flawed. And that's what we aim to fix. That's part of research. So it's part of the outcome. It's part of innovation. It's part of what we look for when we have an external partner. So, and interestingly enough, I asked myself these questions as I was sitting there at my desk as a minister, and I sit at the federal tables. We talk about Indigenous child welfare at the federal table, and while I'm somewhat of a product of that, and the federal ministers and the ministers from right across the Canada is sitting at the table, and most of them are men, ironically enough, talking about Indigenous children in care. And I'm like, well, wait a minute here, and you were speaking about me. Actually, I do have a thing to say. I have something to say, and I think you must listen. So I bring a perspective that sometimes not everyone maybe understands or is open to. As an Indigenous woman, as a grandmother, as a mother, as a person that was raised in the only isolated community in the Yukon. And so I try to bring that unique perspective to any conversation and any table I have, because it sheds light. It needs to shed light on how we build relationships and what we do with data, what we do with research. Who takes ownership? So what I really learned early on was the Canadian Initiative for Health Research, or CIHI, we've referred to it in my office at the time, was that all of the data we were collecting through our health services agencies in Yukon, through medical services, would be gathered up and sent off to CIHI, or the Canadian Institute of Health Research data center. And it was housed there, and it was held there, and it was Indigenous data, and the Indigenous data was collected over time. We were not using it, but part of that meant we had to have the tools. So do you have privacy legislation? Do you have privacy protection? Do you have a data repository that is protected and firewalled? Do you have policies in place? Do you have all? And then do you even understand how to define this encrypted data that is then shared down to you? So we didn't really have all of that. We still don't. But the research goes up and it stays in this black box somewhere, and we have to try to get it back down to our communities so that we can effectively look at policy initiatives and service delivery models, because fundamentally we have the objective and we have the tools and we have the jurisdiction in which to negotiate direct control of health and health initiatives in Yukon. So we pushed very quickly. We talk about patient-centered, patient-oriented research, which is a continuum, right? It's a continuum of services, a continuum of healthcare. It gives a keen eye to ensuring we have appropriate representation of stakeholders, and we look at caregivers, and we look at peer supports and community supports, and we look at the government's involvement. And then we look at, how do we conduct these research? How does the research conducted? Multidisciplinary approaches and teams. Relevant stakeholders, we think about how do we apply the knowledge generated and gathered? What are we doing with that to improve healthcare systems and better practices in our communities? So I think we've moved mountains in a very short period of time, but one of the first priorities for me was looking at where is this data? And so, of course, we could have taken direct control over why SPORE, right? Data research. There's a government obligation. It's government responsibility as Yukon government. Canada has an obligation to Yukon. Was that something we were capable of doing? Not at the time, because we were at that point heavy into researching a better practice approach to healthcare. And we took to the table in dealing with Yukon seniors and senior care. We took to resolving family children services files and structures and protocols in government. We took to looking at putting people first and hiring the experts. That was the first big initiative. So hiring the expertise to do the research required and putting people first. And it took a long time because they went across the Yukon and they did comprehensive research, and they provided a solid recommendation to the government, to me as a minister. 78 recommendations, in fact, on what I could do as a minister to look to health outcomes, patient-oriented approach to care. Because I think that as part of that research, they really closely looked at different models, right? There was certainly not always the case that Yukon is flawed or it's not working. It is working to the best of its ability right now, and we are advancing quickly because we are now have stakeholders, we have partners, and we're advancing in that arena. I guess we're moving quickly together, and I value that. I appreciate that. And we look to our partners at the South Central Foundation in Alaska. We look at BC Health Authority. We look for best practices, because what we don't want to do when we look at research, we're regurgitate and do things over and over again. We've already, and as they say, as it's said too often, don't research me over and over again. You've done it once, don't do it again, right? Don't do anything with me, on me, without our communities. Speak to us, but don't keep coming back and asking us the same questions over and over and over again. Let's look at best practices. There are many, many models out there, but the two that are closest to home, there was the NUCA model and then the First Nations Health Authority in BC. And what have they done? What does their story tell us? And how did they get to be powerhouses in healthcare in their regions, right? It's not so much about healthcare. It's about everything that SPORE is designed to do: capacity development, research development, data outcomes, data input, and then objective of trying to look at influencing and modernizing change in Yukon. So the SPORE initiative is not very old. It's fairly new in Yukon, and it's associated and directly linked to putting people first. And it didn't just happen because Yukon University and happened to be ready at the time, because I can tell you they were not ready. And maybe they're still not ready. Government of Yukon was not ready, but it was a placeholder. It was a placeholder for me then as a minister, working with the federal minister to say, look, we're not capable, we're not able to at this time, but it's critical and it's essential, and we need to put a placeholder somewhere, and then we can come back and revisit and analyze. And I admire the efforts of holding these summits, because this is where you get your feedback. It's where you get your good information. Is it working? If it's not working, what can we do different? And how can we link it with other initiatives that are happening around us? The management and the patient-centered approach talks about prevention supports as well as training and capacity in-house. Well, we talk about nurses and doctors and specialists, and we talk about this impressive array of services that we want to build in Yukon, but we have to have a system that works for us, right, with us, and that's going to work and build capacity. You've got universities ideally situated to help us, build those capacities, but at the same time, there's we all have an obligation. So data is foundational to success. It's the first step to success. You're going to research, you're going to collect data, and that's the first step to success. Success is really built on research, because research in our way, in the Indigenous way, it tells a story. It tells our story. It tells the patient's story. It tells a community story. Sometimes it tells a community story of loss, particularly with Indigenous communities. And we are oral people, so we share by way of story. We don't go around collecting mountains of data on ourselves, right? It's just not possible. But we will tell you a time when something happened, and then you'll start seeing synergies, or you're seeing connections between one scenario and another scenario and another scenario, and you'll hear of grief and trauma. You'll hear people misdiagnosed, or young people gone too far too soon due to the toxic drug overdoses, right? In our community. Right now, you think about it, we're doing research, patient-oriented research, and looking for outcomes. The same time, other things are happening around us. The coroner just called an inquest in Yukon into researching the 4 deaths that happened at the Whitehorse Emergency Shelter. But last month we had 4 more deaths, right? This year we had 18. What do we have in total? We're pushing over 100 now. We just had 5 in across the border in Fort McPherson. But the research is telling us something. So what is the research saying? What are we hoping to accomplish with that? And how do we merge these things together when we talk stakeholder groups working together, communities working together? It troubles me. It troubles me as a chief, but it troubles me as a Indigenous woman as well. We don't look at statistics. We say, well, this is the statistics in the Yukon, as we have the highest drug overdose rate in all of the country, and per capita. And that's not a story we want to tell. We want to tell the story of a beautiful young lady that was a role model in our community, that caught in a system that's not working, that is not working for her or them. And what do we do about that? We collect a bunch of data and a bunch of research and recommendations, and the story is a story that has to be told. But yet we force ourselves to the table. So we have a jury of 6 people, then we'll collect evidence, and then we will engage for sure as one to put in. But at the same time, it puts burden and tax the government even more. So we have to make it as easy and as smooth as possible. So we essentially really need to control more of the narrative, right? And so the approach with SPORE is really about narrative, and is trying to look at an integrated approach to how do we tell a story, but whose story are we telling, right? And at the same time, it's the influencing the outcomes with recommendations for a better future for our young people. And one of the things, if I've learned anything in my role in my community, is you never do anything without the children in mind. Everything we do is for the children for 7 generations from now. So Government of Yukon has partnered with Yukon First Nations on the 2nd phase of putting people first. Okay, it was a 4-year based research project that I addressed that had 78 recommendations, and that really tried to represent the voice of Yukoners. But in that, we had Indigenous representation, which was unique and new then to us, because we had Diane Strand step forward and agreed to bring a voice to table, bring voice to the research, because we wanted our history told. We wanted to know what was happening, and I felt as a minister at the time that we needed to have that balanced approach. And because we collect research, it's not so much about the just qualitative data, just quantitative data needs to be analyzed. So we have to look at the justification between both, right? Program services. It supports us as Indigenous communities to get to the negotiating table. So we should go somewhere to draw down some resources, research. It'll help us then to better access the services that we need. And my story is that, you go back to 1999, 2000s, the evolution of health, right? Negotiated drawdown of health services. That is still happening today. Every 5 years we get to the table, we negotiate the evolution of services, equity in services, right? Services equal to that of other Canadians. The Territorial Health Initiative funding is no different. Yukon gets to the table and negotiates down services and funding for its people. That's what we look at when we look at data sovereignty. We look at health data sovereignty. It's critically important with implications on the well-being of and self-determination of our communities. So, question we ask ourselves then: who owns the data? What does that mean? What does the data mean? But what are we hoping to get from the data, and how is it going to help us to look at drawdown in negotiations, right? Drawdown of in-time, real-life negotiations. So can we actually just tap into Yukon University and say, hey, we need data on our communities in this particular area? Or do we go back up to Canadian Health Research Centre and say, hey, we need access to our in-time data? And then we try to decipher that and work with that. So it's all evolving. I know the second phase of putting people first is called the First Nations Health Authority, First Nations Health Initiative. That requires us then to go back and do a deep dive at the deep end of the pool, I guess you might say, to look at what have we done historically, who's responsible, what does the First Nations model look like? Is it the Nuka model? Is it the BC model? Is it built in Yukon model? What does the research model look like at SPORE? What does the research model look like in Canada? What does the government of Yukon's model look like? How are we going to take all of this information to make it one successful model in the Yukon for Yukoners? Because I look always from an Indigenous perspective, but I want to just respectfully say that there are other cultures that have now merged in the Yukon that are evolving in Yukon. We have those the immigrants that are coming from other countries, and they have different cultures, they have different languages, they have different teachings as well. And we've not really spent a whole lot of time on that. So customized solutions is important, but all a conversation for another time, because culture or respect and understanding is really critical when you do research. And I want to just take a moment to acknowledge Wilberforce from the Yukon University, because he came to community, and he's he clearly submerged himself in the community, and it's like, I love Okro, I want to move to Okro, and because he saw the community and he saw in his heart he was very much a part of the community, and the story he told was to not his lens, the lens of the people, with respect to impacts and effects of COVID. And so not everyone has that fortitude, I guess. Not everyone has that ability to just step foot in an isolated Aboriginal community where you see no sunlight for a number of months and adapt accordingly. But he seemed to have loved it. So we look at traditional knowledge, right? And I spent a number of years as a director of the Self-Government Secretariat for Yukon First Nations, and that is to deal with implementation of self-government agreements. But it also looked at fiscal negotiations, health, human resources and capacity, and data governance. The First Nations Health, the First Nations Data Governance Center back in the day. That was our vision at the time. And we tried then to look at building ourselves up so that we can be this powerhouse in the future. But we now see SPORE as that, because we were not able to keep the momentum in a successful way, because money is important. You have finite amount of resources to keep these things moving. Spores very much is the same. There's no guaranteed funding year after year after year. So we have to think about it as, what is it that we hope to accomplish in the time frame and the time that we have allotted us ourselves to get the outcome we need. And so it's important for us to look at self-determination, but we look at autonomy as well, right? So self-determination looks like what, it doesn't always have to be directly related to our self-government agreements. It covers, just aligning data alignments. It talks about the principles with which sets the principles for self-determination, and enabling our communities to make decisions about our own health priorities, enabling our communities to make, decisions about health data, health management, about research, and about unique perspectives and about unique circumstances. And really, at the end of the day, it's about trust, right? Building trust in the community. Because when we talk about health research, it's a very private information, and not everyone wants to share that. So you take it from a very, 90,000 foot level, and you think, oh, well, we have to protect individuals. So if it's under 5 or it's going to pinpoint to an individual, we want to try to keep it high level. But small communities, you can't do that. It's important we know this information because it helps us, even if it is 5 people, right? So what is it that we do with the information we acquire? And when we think about it from a customized perspective, right? It has to be customized and it has to be solutions oriented. And data is not, data is really, sovereignty is based on who we are, but what we it's about our data too. It's about our information, right? Data sovereignty. It allows us to develop healthcare solutions tailored to specific needs of our population. And in Old Crow, it's really important to us because most of the community, 90% of the community is Indigenous. But I think I'll recite the former chief, Joe Linklater. He said, it's not an Old Crow problem. It's not a Buntakwitchin problem. It's a Yukon problem, because the Yukon government has an obligation to support Buntakwitchin because they have citizens here. Canada has an obligation as well. So sometimes we see Buntakwitchin as a standalone, but we're not. And we need to look at it from that lens. We need to look at, as we design and implement research, we have to think about policies. We think about the programs and services and our unique challenges. What is your goal? What do you hope to accomplish here in the community? So we put a lot of effort into strategic planning here in our community. We put a lot of effort into collecting our own data. We put a lot of effort into getting ourselves ready for our fiscal renewal, our federal transfer agreement, which is equivalent to FIF, right? Which I spoke to earlier. It prepares us then to draw down and hit the table negotiating with Canada. But we then go to Yukon government as well, and we look some like services, right? And so we also have to think about exploitation of data, exploitation of research, because we've seen that far too often in our history, is you take data, you take research, and then you exploit the people. We can't do that anymore. We have to speak to the people. We have to speak with the individuals, the communities, the families. We have to talk to the governments. We have to say, is this appropriate? And we move together. That's part of putting people first. That's part of the First Nations Health Authority. And that's how success looks in BC and how success looks at the NUCA or the South Central Foundation. And it's looking at empowering communities, because we don't want to negatively impact communities by researching them. We want to look at positively impacting the outcomes. As we do that, we started to look at tools and empowering our communities by building capacity and managing not just data, but also who's going to deliver and implement and manage this stuff, right? Because there has to be critical analysis done of all of the research that's collected. the critical analysis have to be implemented and interpreted, because it has to be an interpretation of language we understand as the NGU and as governments, because sometimes we don't understand that. We don't understand some encrypted data that's presented to us and research that's done for us, about us. And we want to be able to analyze our history. We want to analyze, and we want to be a part of that, because there's measured outcomes. We look for the measured outcomes, and we look for, just the First Nations governments. Each First Nation government, each community is unique unto itself in the Yukon. It brings unique circumstances. Ross River is like Oak Grove, but it's unique. It's different. Trontequichin, there are incorporated communities. There's municipalities within. There's lots of dual responsibilities. Vantaquichin is the only community in Yukon that's isolated. We are not municipal. We are Vantaquichin. So in that vein, we are unique. So data and research will have to be tailored to Vantaquichin, much like Selkirk is unincorporated, and it's only the Selkirk First Nation, but they have a road too. So accessibility and ambulance will come and go, and services will be provided in time, in very short periods of time. So I want to just kind of say that is essential and critical for us to look to when we look at putting together models in the next phase of SCORE. What are you going to do in the next year? You've been now, 4 years in the making? And what's the objective, right? What do you hope to go year to year, right? Because Canada defines in your funding agreement what it is you're intending. So Canada says that that you will provide. They define your funding agreement, right? They define your funding agreement. And it's a time-honored tradition, really, for First Nations, a spiritual, mental, physical, and a two-eyed seeing approach, Indigenous perspective. Honor our way, honor us as communities, honor our unique circumstances. We need to control over deciding factors and institutions that collect evidence and collect data. And we also need to be responsible for our own service delivery model. Because no one individual is an expert in any field. Collectively, we are better served working together, right? And Yukon is not perfect, for sure. Yukon is not perfect, but we strive for excellence, and we will continue to strive for excellence. And a huge piece of that is this work that's happening across the Yukon, right? We have somewhat of a system in Yukon, and maybe it's not that great, but it will improve. We need to raise the status of our people. We need to raise the health status of our people. Chiefs Committee on Health is a second piece that I wanted, final piece I want to just highlight. So I am now the chief of Vantaquichin, but I represent Yukon First Nations on the Chiefs Committee on Health. The Chiefs Committee on Health was established to provide direction and oversight regarding the transformation of health and social systems to support improving patient, client responsiveness, experience, and outcomes, and create an equitable health system for all Yukoners. That's what the Chiefs Committee on Health is intended to do. So I sit on the committee as a chair. So I talk about the circle. Well, this is my full circle. I sit there as a Chiefs Committee on Health. I have beside me Darla Jean Lindstrom and Tanya Silverfox from Sam Carmax. Our technical committee is made up of Stephen Mills, Diane Strand, and Doris Bill. And we work with the government of Yukon and their team of DMs and their team of technical advisors as well. Our objective is really to look at implementing the second phase of the putting people first. We are expecting, the government of Yukon is expecting to table new legislation to create Health and Wellness Yukon in the spring of 2024. And certainly appreciate our partners and how quickly we're able to advance healthcare in Yukon. We need to develop a well community together. We need our young people to lead us in this. We need to ensure that they have a chance to share their stories and their vision, because our young people don't have a whole lot of health history because they're healthy, they're young, they're vibrant, they're still living a beautiful life and they're exploring the world, but they have a vision for a better future because it's their future. And we've not yet stopped to ask them that question. And I want to propose that, time is taken to do that. They have passion, they're committed, they're innovative, and they have untapped potential. We need sustainability. We can't have program shortfalls that is supported by finite resources and people power. When looking at health services, we need to consider our people, not only from a service use lens, but really from a service delivery model, one that works for them no matter where they choose to live, work, or play in this vast territory that we have. We think about succession planning. What does that look like? Let's tell our own unique stories, a story, some yet to be untold. I think about all that as I look at my involvement as a chief city on health. And, next week I'll be presenting to the Yukon Chiefs again, just about the next steps and how quickly we can move on accessing resources and data so that we can better control our outcomes, so that ideally we can be treated equal to that of other Canadians. Services of other Canadians. Why is it that I have an elder being, removed, or not removed, but being released from the Vancouver Emergency Hospital and is in a hotel room, but doesn't have a hotel room. And he's 70 years old, calling me as a chief in Vantakwichan to say, what am I going to do? I don't have a room. And my heart surgery went really well. I'm feeling a lot better, but now I don't know what to do because I'm in downtown Vancouver and I'm scared. Is that acceptable? One would say absolutely not. That's the type of things, these are the stories we have to tell when you start collecting data and research, right? It troubles me that we are still dealing with these types of matters, but at the same time, had huge leaps and bounds in Yukon, and I really look forward to the next year. I look forward to seeing what sport can do for us, with us. I look forward to our partnerships, and as a chief of Vantakwichan, I want to just say, thank you to Yukoners, thank you to everyone, that my community. I appreciate the opportunities that I've had, and as a young person, nowhere else in this country would you ever have the experience that I've had. It's because of Yukon, because of where we live, and it's because of the opportunities in Yukon, the flexibility and the ability to move and advance your own careers, but always to think your career is governed by the people. Your career in health has to be driven by the people. It cannot be from a selfish perspective. It cannot be from my lens as Pauline Frost. It's my lens as Vantakwichan, my lens as an elder, my lens as a grandmother, and my lens as an individual, and that is defined as having a unique experience in Yukon, because I share that. All of us have those unique experiences that we bring to the table, and it's equal lens, equal voice, and bring our stories to share with others. I think it's important that we do that because it's our way, it's our Indigenous way of knowing and sharing by way of storytelling, and I really value that. I look forward to seeking better health improvements in Yukon, and my work as a Chiefs Committee on Health will do that. It'll allow me still to participate, be at the table every day, while still also taking responsibility for my role as a chief of Vantakwichan, because last thing I want is for my people here in my community ever to be left out of anything with respect to healthcare, health models, health research, and implementation, because we have a brand new health center being built here. It's an opportunity and untapped potential. So, Masi, I really appreciate spending time with you this morning. We all have stories, so that was my story, and I appreciate the time. Thank you, and thank you, Davida. for moderating. For those that don't know, Davida started her career early on, and she worked for me at when I was the director of at the self-government secretariat, and she started her research then. And I admire her growth and her development, and now look at where she's at. Everyone has that potential. So merci.
Thank you so much, Chief Frost. That was amazing, and I can tell there were lots of notes being taken in the room. Really appreciated and continue to appreciate your leadership in this area. There's going to be lots of exciting transformations in the next couple of years, and I think when we talk about the changes that are coming up already in 2024, that's really exciting.